That some people are still joining us, but I'll go ahead and welcome everyone, and good morning, good afternoon, good evening. I know you're all based in different places, so thank you for taking this hour out of your day to come join us. I'm really looking forward to this exciting discussion. So today's webinar is co-hosted by Breakthrough Action and USAID Advancing Nutrition. My name is Laura Itzkowitz, and I'm going to moderate our time together today. I'm a Nutrition, Social, and Behavior Change Advisor with USAID in the Bureau for Global Health, Office of Maternal and Child Health and Nutrition. I'm pleased to open this webinar, which will highlight some exciting new work to improve community-level nutrition counseling with resources for community health workers and other community cadres developed in Nigeria through a human-centered design process, as well as highlight updates to the IYCF Digital Image Bank, and we'll talk you through how that Digital Image Bank can help you in your work. After these two presentations, we'll have time at the end for your questions and comments. We know that community health workers play an essential role in encouraging many priority behaviors to improve nutrition across the globe. In today's first presentation, the goal was to think about ways to transform the interaction between CHWs and caregivers and develop tools to help CHWs play an even more effective role as influential and trusted sources of information and advice. While it was developed and tested in Nigeria, it has potential for adaptation and expansion to other countries and was planned with this type of global application in mind. The second presentation highlights new content in the IYCF Digital Image Bank, a collaboration between UNICEF and USAID Advancing Nutrition. It will show you how anyone can make simple edits and adjustments to the images of the image from the image bank. So next slide, please. Please note that all attendees are automatically muted to avoid any interruptions and noise during the presentations. Though I want to direct your attention to the Q&A box at the bottom of your screen and invite you to submit questions throughout both presentations. As I previously mentioned, we will hear both presentations and then have reserved time at the end for discussion. We're recording this webinar and we'll be sharing links to the tools presented within it as well. Both the recording and the links to the tools will be shared following the webinar. So next page, next slide. So it's now my pleasure to introduce the first presentation from Breakthrough Action Nigeria. Dr. Shitu Abdua-Guye and Angela Samba will walk us through the process of how they applied human-centered design to complementary feeding counseling in a way that built trust and empathy between CHWs and caregivers to build true connections between them. So next slide. And Dr. Shitu, over to you. Or is Angela, are you going first?
I'm going first. Thank you. Good morning, good afternoon, good evening, everyone. So I'll begin the presentation and now hand over to Angela in due course. Next slide. So this was an activity that was conducted in Nigeria to explore developing improved tools for community health worker counseling on complementary feeding. And while all components of IYCF are important, complementary feeding is critical to young child nutrition and therefore their lifelong growth and development. So it remains a global challenge. The incidence of malnutrition in the first 2 years of life is directly linked to inadequate breastfeeding and complementary feeding, and other factors that bring about malnutrition in these children. Community health workers and facility-based healthcare workers are very critical for providing counseling to caregivers around complementary feeding. And this is why they're the focus of many tools that have been developed to improve the practices of complementary feeding and in many countries. Next slide. So what's the current situation with the existing counseling tools? What we've observed in many countries is that the tools are rather didactic. They may be comprehensive in their content, but it's usually used in a one-directional way with CHWs more or less telling caregivers what they should do and giving them generic recommendations around complementary feeding. The caregivers rarely have the opportunity to have their voices heard adequately, have their needs addressed specifically, and to ask quick questions about things that they may need answers to that have not come up during the discussion with community healthcare workers. There's also often a lack of trust between community healthcare workers and caregivers, and the current tools that exist are not sufficiently designed to address these barriers to quality counseling. So the goal of this activity in Nigeria was to provide community healthcare workers with the tools that they design themselves and find easy to use, meaningful and impactful when they counsel parents and caregivers around complementary feeding. Next slide. So Breakthrough Action Nigeria, Advancing Nutrition and Think Place, in collaboration with other partners, I decided to conduct a HCD-led activity with the focus question: how can Nigerian community healthcare workers better educate, empower, and activate caregivers to initiate complementary feeding from 6 months and improve dietary diversity for young children from 6 to 24 months of age? Next slide. We went through HCD process where we uncovered challenges and came up with insights, key insights around complementary feeding practices, interviewing both community healthcare workers and caregivers. We moved on to co-develop solutions with community healthcare workers, tested the solutions for their desirability, usability, and impact. And we've also went on to improve and develop the final solutions, going through several iterations. And I'll talk a bit more about these different steps in the next few slides. Next slide. So uncovering challenges, next slide. We conducted qualitative research in Kebbi State in Nigeria. This was where the HCD activity was conducted. Kebbi State is in the northeast of Nigeria and is one of the states with the highest prevalence of malnutrition in the country. We interviewed 4 cohorts of respondents, community healthcare workers, mothers and caregivers, community leaders and peer groups, and household influencers. We used various methodologies, remote and digital approaches, including the Engage platform, which is a tool developed by Think Place. We conducted desktop research to understand the context in Nigeria and in Kebbi State, in addition to conducting one-on-one interviews with the different cohorts of respondents that are listed above. Next slide. So the key outputs or outcomes or findings from that from the discovery phase of the HCD process was as summarized here. There was an absence of support to build trust and empathy between community healthcare workers and caregivers. The current tools, like I said earlier, do not allow for that personal connection to be established between community healthcare workers and caregivers. So that's initial empathy that needs to be built between the counselor and the caregiver doesn't happen, and this tends to affect the process of counseling from there on. There was absence of tools to tailor counseling to the situation. While the tools were comprehensive in content, they didn't always address the specific needs of caregivers in their own context and the situations they had with their own children that they were taking care of. And so those challenges were not necessarily addressed, even though they had this broad counseling that they got with the tools that existed. And the tools that existed also did not consider other influencers around the caregivers and the parents of children, like the fathers and mother-in-laws, who have a role to play in determining the quality of nutrition that children get at household level. So these influencers were left out in engagements during counseling sessions because the tools were designed primarily to address the caregivers themselves. Next slide. So we could develop solutions with healthcare workers. Next slide. we took the insights that came out and around from the discovery phase, from the uncovering the challenges. And there were several buckets for these insights around trust and empathy, uncertainty and fear around foods to feed the children, and then food-based norms. We took these and came up with the challenges specific to the insights, and developed some different prototypes to address the challenges that were associated with each insight. You would see at the bottom there that there were 2 prototypes that were proposed around relationship building, and 2 others that were proposed around knowledge and norms. Not all of these prototypes made it to the testing phase, but these were the ideas that came out at the beginning when we were coming up with solutions to address the different challenges that we were observing from the field. Next slide. In addition, there were challenges around attitudes, confidence, and agency, and several other prototypes at the bottom there came up around addressing these specific challenges. So the price comparison, counseling flow were for around attitudes, and the trivial game, counseling flow again, and action plan were around the confidence and agency of caregivers to provide adequate complementary feeding for their children. Next slide. Thank you. So I think I'll hand over to Angela from here to take it and take us through what came from the testing and the tools that we eventually came up with. Thank you.
Thank you, Dr. Shito. And good morning, good afternoon, everyone. Next slide, please. Building on what we did from the research and the prototypes that came out, we went through testing of those prototypes. And for the testing, we engaged with community health workers. So we can see that community health workers will engage with mothers and caregivers. So we can see that we had more community health workers and mothers and caregivers engaging with these tools, because they are the primary audience for this tool. And like Dr. Shito mentioned earlier, we also had other influencers that we considered, and we engaged them in the testing for these tools as well. So we had community leaders, we also had household influencers engaging with these tools. And the methodology we used was focus group discussions. We also had one-on-one interviews at different levels with the different tools. We also had job shadowing. We used co-design sessions as well, where we engaged with them. We had discussions around these tools and how they could be better and tailored to address the complementary feeding needs of the mothers, and also the counseling needs of the community health workers. Next slide. So this tool was built on the foundation of empathy to encourage the community health worker and also the mother, so that the mother's confidence is built and she's able to express herself. And with the purpose or the objective of this tool, to build that trust and provide tailored counseling or tailored counseling to the need and of that mother. This is very important because it helps the building empathy helps to build that trust. It also helps the mother to feel relaxed and easy and able to express herself. It also enables the community health worker to understand the needs of the mother and provide counseling that is tailored to address the specific needs of the mother and help improve complementary feeding. This also helps the community health worker and the mother to prioritize the need to focus on in the first meeting. And so when there's a follow-up meeting, they're able to agree on what next steps to do, or how to measure improvements. So it's actually really tailored to the needs of the mother. And next slide, please. So we had two sets of tools. And we call the tool the Nourishing Connections. Just like the objective of the tool is to build empathy, to build trust, and also help the mother make decisions around complementary feeding, help the community health workers provide tailored counseling, and improve their skills in counseling, share their experience, and help the mother to improve complementary feeding practices. Next slide. So like I said, we had two sets of tools. We had the main tools and the supporting tools. The main tool had 4 steps, which is the Empathways, the accessing caregivers' knowledge, and then counseling flow. Then the final step is the action plan. I would talk briefly about each of the steps. And then we also had the supporting tools, which are the trivia game, the card game, and also the price comparison. So for this main tool, which has the 4 steps, based on our testing and our findings, we saw that it worked better in one-on-one counseling. So it's a tool that would be used for, or tool that is used for home visits, where the community health worker has the opportunity of engaging with the mother or the caregiver one-on-one. And then for the supporting tools, there are tools that could also complement the main tool, and they can also be standalone tools where you could use them to engage with groups. So when you have more than one person and the community health worker is engaging with more than one person, they can use any of these tools, the trivia, the card game, and the price comparison, to engage with them and help them to make decisions based on the needs identified concerning the complementary feeding needs of the children. Next slide. So the Empathways is the first step of the main tool. And the Empathways provides an opportunity for, it starts with the community health worker saying a pledge or agreeing on a pledge with the mother, and the aim of this is to build the mother's confidence, help the mother to understand that every conversation they have would be private. We also understand from the testing that a lot of people are concerned about confidentiality, which is why they don't express some of the issues or the challenges they have around complementary feeding and even other nutrition behaviors. So this is to help build that confidence and build that trust. So the caregiver is comfortable and they are reminded and is reinforced that everything they say will be held in confidence and will only be used to help them make decisions that would help improve their child's nutrition. So after that, there are also questions that the community health worker and the mother would answer. So some of the questions are questions that both the community health worker and the mother answers. And they also gives the community health worker an opportunity to share their experience with the mother, which also helps the mother to understand that some of these challenges are not unique to them, and the essence of the conversation is not to judge, but to help the mother make informed decisions. We can see that this was a testimony from one of the mothers that said that was the first time she was asked something during this session, and that's the first session that she thinks she would remember what was said because of the level of engagement she had with the community health worker and how the community health worker asked questions and also provided their own experiences to help the mother understand that these needs are not specific to you, but there are ways to help improve some of the challenges you have and address some of these challenges to improve your child's complementary feeding. Next slide. Next. Okay, the assessing the caregiver's knowledge is the next step after Empathways. So this assessing the caregiver's knowledge also has steps. It provides an opportunity for the community health worker to assess the caregiver's needs. And then we have them in 3 buckets. The community health worker, based on the assessments and the responses she gets or he gets from the mother, is able to classify the mother's needs based on knowledge, attitude, and practice. So based on the responses that the mother provides, the community health worker understands if most of the mother's needs are tailored towards issues around knowledge, or if they are tailored towards issues around attitude or practice. And this also helps the community health worker to know what to prioritize. So if most of the mother's needs are, or she understands that the mother has gaps around knowledge, it helps the community health worker to tailor the counseling towards improving the knowledge, starting with improving knowledge. If the caregiver has knowledge but has issues around attitude, it also helps the community health worker to tailor the counseling towards addressing those attitudes. And then it also helps the community health worker to choose the appropriate tool that would address the identified needs based on the engagements she's had with the caregiver or mother. Next slide. So the third step is the counseling flow. So the counseling flow provides a set of questions to identify the current situation and reflect on the change since the last session. So it provides an opportunity for follow-up, like I mentioned with the last two. The with the last step, the community health worker is able to identify the needs of the mother around, either it's around knowledge or attitude or practice, and also prioritize. So this counseling flow provides the opportunity to go back to that discussion and look at what are the issues that were prioritized and focus on and solve those problems that would address those specific issues. It also provides an opportunity to prepare next steps or next step action that would be taken to address other needs. And with engagement with these two also gives the opportunity for the community health worker to look at follow-up actions. So if there are issues that they need to follow up, so it helps the community health worker to go back and see, okay, where did we stop with this mother and where do we continue from here? This tool also works with the next tool, which is the action plan. Next tool, please. Then next slide. It also works with this tool, which is the action plan. And this action plan actually works with all 3 steps. So as the community health worker is engaging with the mother or caregiver at every level from the first step, if there are actions or decisions the mother has decided they would take, it is documented on this action plan. Even though it's here as activity 4, but it's a tool that can be used across the session from the beginning till the end. So as they're having discussions and making decisions and the mother is agreeing on steps that she would take, or the caregiver, this is documented on this tool. And it also helps them to make recommendations on what the mother would take going forward based on what they have learned and what they see that they are able to do. So with this, with the testing using this action plan, I know a lot of people would wonder, we are working with people in communities who mostly cannot read and write. So with this tool, the community health worker may have to be the one to document the action plan. If the mother can read and write and she's able to, it's fine. But the community health worker can do it. And share a copy with the mother, and also have a copy, keep a copy with them just to follow up the actions. So, and from experience, we always have mothers asking, we had mothers asking for these action plans so they can document it and even have them as reminders of actions they've decided they will take. I always say they have other people that could read and help them read it. And even for those that could not read, they said looking at the form reminds them that, okay, I've made this decision and I've decided I'm going to take this action, and they take it they take it forward. We can see a testimony from a mother, a caregiver here that says, I can keep this paper, I want to put it on my wall. And the reason is just so that she can be reminded of actions that she decided she was going to take going forward. Next slide. Okay, so the orientation videos was also incorporated into this. These orientation videos, videos of community health workers and videos of caregivers and mothers sharing their experience working with community health workers, and positive experience actually of how community. So for the mothers, they were talking about how their experience was working with community health workers and how community health workers had helped them to make decisions around their child's health that helped them. And this encouraged community health workers to provide the tailored support. And mothers also shared the importance of community health workers sharing their experience, which was something that helped build their confidence and help them to make decisions. This was important because for community health workers, a lot of times sharing their personal experience felt like exposing themselves and exposing their weaknesses and sharing that sharing their weaknesses. And so these testimonies from mothers actually helped community health workers to feel confident to also share their experience, and seeing the impact it had on mothers encouraged them to do that. And then the ones with the community health workers as well, community health workers, the videos with the community health workers, we had community health workers that talked about how they do counseling and how they engage with mothers and what they've had mothers share with them. This also helps to build the confidence of mothers and community health workers, and also emphasized on that point of empathy, where sharing experience always helps to build that confidence and makes the mother to feel relaxed and able to express herself and share, and gives the community health worker also an opportunity to learn the specific needs of the mother and help the mother to address those specific needs. Next slide. So some of the learnings we got from the testing, community health workers resisted sharing personal experience, which is what I talked about in the last slide. And those videos actually really helped with community health workers sharing their personal experience. And like I said, their concerns were they work in those communities, people know them, and people could gossip about them, and then they could look weak, or they would lose control of the process in sharing their experience. But they saw the benefits, and those working with those videos also helped to build that. Then we also had compassionate counseling requires different skill sets. So yes, so the compassionate counseling requires people to listen actively, and also requires people to be vulnerable. So asking and probing questions, writing down key points, and all of that, which was something that some community health workers found challenging. It was hard for some to listen to so much that the mother is saying, and also be thinking alongside and helping the mother to make decisions. But using some of these tools, and especially even the supporting tools, also helped the community health workers to navigate through this. Then using gamification was a very good format that people found really interesting. Like I said, some of the supporting tools were games like the card game, the trivia game as well. And even the price comparison, engaging with it, people found it quite interesting. The community health worker said the game is their favorite. One of the community health workers said the game is her favorite by far, and they don't need to ask for attention because everybody is paying attention without them making so much effort. Next slide. So we also checked the global application of these tools. Next slide. So these tools are built on a concept that can be applied globally. Empathy is something that everybody resonates with. Empathy encourages, Empathways creates an empathic counseling session where there's a two-way relationship building. It sets up an experience that is supportive and empathetic. So because of once empathy is built, once there's trust, people feel comfortable to express themselves. And any counseling that is built on empathy anywhere in the world is counseling that is likely to succeed because it helps to identify the needs and also tailor the solutions to address the specific needs identified. Community health workers may need new training, mentoring, and other community and facility support to change their expectation around using these tools. But this is a concept that actually can be applied or works globally. Next slide. So focusing on 1 to 2 topics, prioritizing the caregiver's needs is also something that would be helpful in counseling anywhere. Counseling flow actively help the community health workers to ask questions and focus on 1 to 2 topics that is most relevant for a mother in addressing the needs that are specific to the mother that was identified during counseling. So this is this enforces or focuses on prioritizing the mother's needs, and also reminds community health workers that you don't need to address, you may not be able to address all of the mother's needs at the time, but it's okay to take a step at a time. And this is a concept that can work everywhere, anywhere in the world, and it can also help improve the quality of counseling and, of course, the results. Next slide. Okay, so thank you very much. I'll hand over to Andrew.
Yeah, I'll take it from here. Thank you, Angela, and thank you to Dr. Shitu for walking us through this really great work in Nigeria. I'm really excited to see what has come out of it. And so now we're going to move over to our second and final presentation on today's webinar, led by Andrew Cunningham from USAID Advancing Nutrition, and it's focused on using and adapting high-quality illustrations from the IYCF Digital Image Bank. So over to you, Andrew.
Thank you very much, Laura. And I'll start out by thanking the Breakthrough Action team for their wonderful work. I get really excited when thinking about global application of these tools that I've heard so much about. And also thank you for inviting Advancing Nutrition to present on this. When I first was approached with this, I thought these are really different ideas. I have really different ideas and approaches to design, but I think they're really complementary, and a program can really embrace and adapt both approaches to really ensure high quality materials. For this, maybe a little bit more focus on some of those supporting materials from a visual perspective. If you have heard parts of this presentation before, which you may well have, we do have some new updates, but if you haven't, I can quickly go through some of the ideas and the sort of purpose of this image bank. So I'll start off with the problem. We know that high quality illustrations are often an integral part of a lot of nutrition SBC programs. I can see in the chat, we were talking a lot about low literacy populations, and visuals can convey technical information and cultural information and convey quality really quickly. But developing these illustrations can often be a challenge. Most of us aren't artists ourselves, and we know that a lot of visuals exist, but sometimes managing them, having access to them can be a big problem. And when our materials have maybe like a lower quality visuals to them, that low quality might be conveyed or associated with our work, and people maybe aren't as excited about our materials. Advancing nutrition and a previous USAID investment for nutrition, the Spring Project, collaborated with UNICEF because they have a really wonderful approach to IYCF counseling and are often really known for their visuals. So I'm sure many of you are aware of UNICEF's community-based infant and young child feeding counseling package. That's all of the materials on the top half of this slide. This package has been adopted in whole or in part by over 90 countries around the world. And as part of this package, right here in the center, we have these counseling cards, but the guide itself the package itself also has an adaptation guide that really encourages country programs and programs at lower level to adapt the package, and that includes adapting the counseling cards and visuals. So you can see on the bottom a few different examples of adaptations of the generic package for different country contexts. The package adopts an approach to creating visuals called photo to illustration technique. See if my GIF will work. And that involves using photography to create realistic images, line drawings so that you can capture really accurate technical information, but still display cultural context and achieve something that's really high quality without a lot of artist interpretation, without a lot of room for error. As long as you have a really good reference photo, you can make a really good final image. One of the reasons that UNICEF and Advancing Nutrition really like this process is that it's really primed for adaptations. So we can take an image like this, which is meant to convey family support for breastfeeding. All of the thinking that's been gone into the framing of this image is really wonderful. But then we can only use this image in certain contexts where people's clothes, maybe and skin tone match the cultural context of where you want to use this image. But we sort of use these images as like a set of paper dolls, where we can actually take new illustrations with an artist and just, rather than redraw the entire image, just take the cultural information and sort of put it on top. So this is an adaptation that was made for Niger. We'll move it to the side. And here's another one that was developed for Senegal. So you can see all three of these images, starting with the generic one that was here in the center, was already developed with a certain idea in mind. And then only the cultural information needs to be sort of adapted and sort of translated to be relevant to where you want to work. I'm going to use this as an example, not to pick on this country's package, but just to use it as an illustrative example. So we can see this is a card from a package that was developed in India, I believe very soon after the generic package was developed in 2012. And you can see that in order to make an Indian package, a lot of new illustrations needed to be developed. And you can see from the center image compared to the image at bottom left, which is from the generic package, that they basically had to recreate the image from scratch. And we can compare that to the image at the bottom right, which was developed by the Spring Project a few years ago, that actually had access to the image files that were developed for the generic package, and were able to just sort of make an adaptation that shows a cultural context, but really doesn't have to start over from scratch. And so that actually is a good illustration of what the image bank is meant to do. So the image bank is a collaboration between UNICEF and USAID Advanced Nutrition, although it was begun under the USAID's Spring Project. And it's a database of all of these images that have, not all of them, but many images that have been developed for different infant and young child feeding counseling packages. And they're being made available so that we can use them to either adapt for our own country context or to create new materials that already can leverage the quality and the technical input that has gone into the generation of those images themselves. So the idea is that rather than start over every time you want to make a new material, hopefully you can browse the image bank and find something that actually is useful for you. And if not, find the closest thing and then adapt from there. Very quickly, the image bank is coded by topic, by organization. We also have grouped all of these images by series. So if, for example, you are looking at an image of, let's see, we do have like child's development milestones. If you find one image, it will link you to all of the other images of that series, as well as adaptations made for another country context of that same image. And then new in the past year or so, we've begun to sort of upload full packages along with key messages up to the image bank. We've found over time that many people who are coming to the image bank might have like a physical counseling card package in front of them that maybe they want to recreate. And so we wanted to make it easy to find, you know, like a specific card and find the images on that card, because we often find people are even like taking photographs of the counseling card themselves and scanning them to try and recreate an image. And we don't have to do that. We can actually go to the source, which are all hosted on the image bank. Very quickly, I'm just going to go through a quick example about searching images on the image bank. Like I said, the coding I think is pretty rigorous, so that even with simple keywords, you should be able to find what you want. So here in this example, I wanted to find that image that I showed before about the different adaptations of family support for breastfeeding. And I know there's a father featured very prevalently. So if I search father, I can see, at least here on this first page, here's an image that I want. And I can go ahead and click through, and it looks like, you know, a Flickr website or a photo website where you can go through, you can see the image in detail. At the bottom left in the blue box, you can download the image so that you can use it or further edit it. But here at the bottom right on this side, you can see other similar images. This is what I was talking about with adaptations, other versions of this image. So over here, this is the one that we looked at before, where the mother and the daughter's heads are covered, this adaptation for Niger, and you can just click through and then find that image. So the idea is that you can always find something close to what you're looking for and then refine your search until maybe you want to use this image outright, or maybe you want to use this and change one little thing, one extra thing, but this is the closest image and you can start adapting from there. So again, really trying to avoid starting over, but trying to get as close as you can and then just make those final edits. The image bank has images from more than 20 different country contexts. Actually, I think it's 23, if I'm not mistaken, and over 1,000 images, although I actually think it's maybe 1,400 at this point. And we're always in discussions with organizations who have developed new images to try and make that image bank grow. And so I want to take one little moment just to show this card navigation feature. So like I said, a lot of people start with a physical copy of the cards in front of them, that they want to find a particular image. Maybe they want to recreate this card. Maybe they just want to take an image from this card and they don't know how to find it. So here is a card from the current version of the Nigeria counseling package. And let's say we wanted to use this pregnant woman who is having a diverse or is who is eating a meal here. If you search mother, most of our images have mothers, so that might be hard to find. So instead, we created this portion of the website. If you're on the image bank website, you can always click on collections here at the top. And that will take you to a long list of different counseling cards. You can always, with each one, find the PDF of the full counseling card package. But some of these links where it says explore the cards, and you can view the cards, in this case, Nigeria cards, will take you to a page that shows all of the cards sort of in sequence. So you can see right here, this is that card that we were looking for. And when we jump in here, we can look in a similar way to the image pages. We can see a thumbnail of the counseling card, all of the key messages that are associated with that card. So if there are messages in participant's booklet in that country's package, or if there are messages that are printed on the back of that card, those can be displayed here. And then there are links to all of the individual images as they appear in the image bank. So if you wanted to recreate that full card, you could download each of these images and lay it out yourself. And then finally, similar cards. These IYCF packages have very similar topics on each card. And so as much as we can, we try to match cards to on a similar topic. So you can see right here, this thumbnail shows the very similar card that exists on the generic package. So if you ever have a physical package in front of you and you want to find that image, here's another way that you can find relevant resources that you can use in your materials, or you can adapt. I wanted to use a very quick example here. This is not exactly IYCF, but Advancing Nutrition, USAID Advancing Nutrition has been developing an addendum to the IYCF package that's focused on nurturing care, specifically responsive care and early learning. And at left, you can see some of the counseling cards that were developed for this package for a pilot that we are conducting in the Kyrgyz Republic. And I use this example because many of our community health workers in the Kyrgyz Republic do not use the full package. The package is used with health workers in facilities. And so our project worked on making handout brochures that community health workers could use to focus their discussions during home visits with the community, and also leave with them so that they could still reference the information and hopefully try to adopt some of these practices. And so because these images were available to us as we were advancing nutrition, but also now available on the image bank, it was very easy to use the same illustrations in a newly designed material. That way there's some level of association between what they may be learning with a health worker at a routine visit, and also the information that they get in their brochures. And then I do want to very quickly finish with a section on using images for new concepts. Like I said, there are 1,400 images, but they may not always show exactly what you want. And images on the image bank are really very fully featured. They are done in layers so that, behind, for example, this woman on this image at the bottom left, there is still like the information of the wall and the floor behind her. And that means you can take several images and move things around to create new concepts. So here's an example where we use the background from the top left image, the woman sleeping under a mosquito net on this image at left, and this father taking care of a child at the bottom, to create a new image that's depicting a new concept, which is actually fathers taking time to take care of their young children, specifically so that their wives, the child's mother, can get some rest. And so that's a completely new concept with already existing materials that can be done without necessarily involving an artist to do this for you. And at times we can use parts of images to create most of an image, and then use an artist to create a new image that doesn't exist. So in this image, which is families including their children with disabilities and daily activities and play, we didn't have to ask our artists to draw everyone, because we actually had a few different people that would work for the scene that we wanted. And instead, we only contracted our artists to draw this one child here who is depicted to have Down syndrome. That might feel overwhelming to look very quickly about how all of these images can be rearranged, because a lot of our software might not always lend itself to doing this sort of work. And so if I open this up in Paint, I can't really do very much with it. And so in the last year, Advanced Nutrition created a series of 4 videos that you can find under the resources tab of the website that take you through the process of making edits to an image without necessarily the support of an artist. So if you just need to like change the color of somebody's clothes or replace a pattern, you can very easily do that yourself just by following the instructions and the examples in these video tutorials. Thank you all very much. I know that was a little whirlwind presentation. You can find the image bank at IYCF.advancednutrition.org, or if you can very quickly pull your camera out and scan that QR code, you can find a link to the image bank there and access all 1,400 of these resources. Thank you very much.
Thank you very much, Andrew. I think both of these were really great presentations, and it's really exciting to see this work getting shared and having more people have access to it. So that's really wonderful. We've received quite a few questions in the question box, so thank you everyone, and feel free to keep adding to that. So we'll see what we have time for in the next 9 minutes to answer. I'm trying to group some of your questions together. We've been trying to do so that way, hopefully, even if we don't answer your exact question, we'll answer your question together with others. So I'll start with Angela, a couple of questions for you, really relating to education level. So, and then how the module is used. So do you use this module in both group sessions and home visits? And then talking about the CHWs, do they need to be health educated, or can they be community health nutrition volunteers or someone who has only knowledge in like very specific areas like community management of acute malnutrition, for example? And then what about the mother's education background? Were they able to read and write? And could you address some issues around the fact that many CHWs in northern Nigeria and throughout Nigeria have very low literacy levels? Not so different from the mothers and other caregivers that they're supporting. And then also, how did you handle education levels of CHWs? Was the tool pictorial? So I know that's a lot, but all around education levels of both the mothers and the CHWs. So for you, Angela.
Okay, so thank you for that question. So we had the tools in 2 groups. I'm answering the question around how we used it in groups or one-on-one. So like I said, the main tools were most appropriate for one-on-one counseling. And then the tools, the supporting tools like the card game, the trivia, and the price comparison were tools that could be used both in one-on-one settings and in group settings. They are tools that provide opportunity for engagement with larger groups as well. So for education, so what we did was we actually did this work in northern Nigeria. And to answer another question, they were community volunteers that we engaged with, but we also engaged with skilled health workers. So we engaged with both groups, both the community volunteers and the ones that had those that work in the health facility that were skilled health workers as well. And they were all able to use the tools. For the community volunteers, we had to translate the tools, but with translation and the guide, they were able to use the tools. And yeah, it's also important to note that they need some level of training and building of skills to be able to effectively use the tools. And with the testing, they were actually able to use those tools effectively. Though we did have a few that had challenges with using the tools, but with exposure, with frequent and continuous exposure, they were able to take it up with that. And with the translation, even the caregivers and the mothers were actually able to flow with the tools. And like I shared the testimony from some of the caregivers, they found it quite useful and they found it helpful. So it's all about having the skills to be able to engage with the caregiver at their level and like I said, it was also focused on building empathy. And so most of the guide on the tool is just.
I think you froze on us, Angela. Oh, are you back now?
Okay, so yes, thank you.
Thank you, Angela. That's good to thank you for answering that question. So the next question is for Dr. Shitu. Can you share some more details on how you collected the qualitative research data using remote digital tools? How was this done and what was the sample size for the data collected?
Thank you. So I've typed a response to that question. The Engage tool is developed by ThinkPlace, and it's developed to be used on chat platforms like WhatsApp and other platforms like that. So it's used to enroll respondents into qualitative interview activities. We use that process also to obtain consent for their participation in the process, and then send the questions as well to the respondents through the WhatsApp-based Engage platform. The good thing about it is that it allows the respondents to respond at their own time, but also allows them to use pictures and other multimedia support for the responses they give using the Engage platform. Typically for these sorts of activities, we do purposive sampling, so it's not really like a very study design kind of approach where you need a sample size to determine if you get a significant results. So we use purposive sampling for this, and the numbers were in the presentation. So if you want to know more about the Engage, we can send you. We have a write-up about that, and also think this is probably a better place to tell you more about the Engage platform. Thank you.
Great, thank you. And actually, a related question for you, Dr. Shitu. How did you handle communities with no smartphones, considering this, or how much, or people who didn't have space on their phones for it?
So we actually combined, not everybody that were recruited for the intervention used the Engage. Only those who actually had smartphones, had network, were available to respond on Engage were the ones who used the Engage platform. Others who were less literate, did not have smartphones, those were the ones that were actually interviewed directly using the questionnaire, the traditional questionnaire and response approach to interview.
Great, and I think I'm going to squeeze in one more question for you, Dr. Shitu, before we end things. So you shared an overview of the methods used to develop the tools for the community health workers, including focus group discussions. Could you speak more about that iterative process within the design sprint and how the different measurement methods came together to inform your final set of tools?
I'm not sure I understand that question, but
so all the different, you had that iterative process.
We had 8 prototypes at the beginning that were proposed when we did the ideation around solutions to the different insights we found. Now, those were taken to the field and tested, and we got feedback. I mean, the typical process for code development and testing iteration, we got feedback on initial designs we had, came back, made them, improved them based on feedback we got, went back to the field. I believe 1 or 2 prototypes were actually, one was dropped and another one was collapsed into another one to make it better. So eventually, with the feedback we got from the respondents in the field, we adapted or improved the different prototypes and landed on the main tool as we have it now, and supporting tools as well, eventually. The measures we use are not off the top of my head now, but of course, we're tracking the feedback we're getting from respondents as we take it to the field and come back and improve and go back again.
Great, thank you. I think describing that iteration of going back and forth is really helpful. So we're out of time now. It is 8:59 on my clock, and we said we'd end at 9. So thank you so much, everyone, for joining us today. I hope you found this as interesting, engaging, and useful as I did. Please do check out the links for the various resources shared in today's webinar, and feel free to reach out to either Breakthrough Action or USAID Advancing Nutrition with your questions. So thanks for joining us today, and hope to see you next time.